Hello, my name is Asher Rip, and I am a former research coordinator at Cohen Children's Medical Center. I'm here to present our team's findings on telehealth utilization in a developmental behavioral pediatrics practice and its effect on follow-up visit adherence during the COVID-19 pandemic when compared to in-person care during the same time period in 2019. Many healthcare practices were forced to transition to telehealth at the start of the COVID-19 pandemic to mitigate the spread of the SARS-CoV-2 virus. Telehealth includes phone calls, real-time video communication, and sending images, but in this study, we looked at only follow-up visits using real-time audio-visual communication. Developmental behavioral pediatrics has long-standing issues regarding access to care, and we know that adherence to follow-up care is critical for improving clinical outcomes in patients with chronic conditions. That's why we sought to describe how a complete transition to telehealth affected follow-up visit attendance in our DBP practice compared to in-person care. We hypothesized that telehealth would be associated with increased follow-up visit attendance due to a reduction in barriers often encountered with in-person care. We conducted a retrospective observational cohort study of all the follow-up visits conducted at our practice from March to April of 2020 and 2019, which correlates with a complete transition from in-person care in 2019 to telehealth in 2020. Our primary outcome measure was follow-up visit attendance, dichotomized as completed versus not completed. We also obtained socio-demographic information and whether the week of visit took place during the first 3 weeks of our observation period or the last 3 weeks. We did not include new patients in our analysis, only follow-up visits. We used logistic regression to test for an association between year of visit and follow-up visit completion, adjusting for demographics and week of visit. Additionally, we used diagnostic codes from visits in both years to understand whether the patient population was different. We analyzed a total of 470 follow-up telehealth visits from 2020 and 1,672 follow-up in-person visits from 2019. 75.3% of the telehealth visits were completed or successful. 64.4% of in-person visits were completed or successful. The average number of diagnoses per telehealth and in-person visits did not vary significantly, nor did the most frequently reported diagnostic categories, suggesting that the patients seen for telehealth and in-person visits were similar. Both unadjusted and adjusted odds ratios of having a successfully completed follow-up visit in 2020, our proxy for telehealth visits, versus 2019, our proxy for in-person visits, indicated that the odds of having a successful follow-up visit was higher in 2020 than in 2019. This effect got higher when we accounted for whether the visit was in the first half versus the second half of the 6-week period. Patients with public insurance were less likely to have a successfully completed follow-up across both years, suggesting that access to care for patients with Medicaid, a historically more vulnerable patient population, remained problematic compared to those with private health insurance, even with telehealth visits. Overall, our results indicate that telemedicine was associated with increased follow-up visit attendance in developmental behavioral pediatrics care. These findings suggest that telehealth may improve both access and efficiency in developmental behavioral pediatrics follow-up care, both through eliminating certain geographic barriers and by improving follow-up visit adherence. Taken in the context of other publications on telehealth in kids with chronic conditions, our study adds to the evidence that hybrid models with telehealth being utilized for follow-up care should be examined in future studies, while investigating and addressing barriers historically vulnerable populations may face with these new care models. I want to thank you for watching our video abstract, and if you want more details, please see our full paper published in the Journal of Developmental and Behavioral Pediatrics. Thank you.